With the pressure being applied to ambulatory physician practices today to reach adoption of healthcare IT milestones over the next 24 months, we find there's a lot of confusion in the marketplace. We'll continue to explore areas of concern for physician practices across areas of meaningful use, adoption of healthcare IT, and selection of EHR vendors. Today we're speaking with Patti Dodgen, the CEO of Hielix, specifically about the risks to physician practices if they're choosing to comply or not with the current regulations. Patti, good afternoon.
Good afternoon.
My question for you today is, what are the primary risks to physician practices if they decide to either not comply or not adopt the healthcare IT that's coming down?
I think there are two major risks. There's one that's fairly obvious because under the Medicare program, if physicians don't become meaningful users of certified health IT before 2015, they risk losing 1% per year for 5 years on their Medicare reimbursement rate. And that's a permanent reduction. It would be 1% in 2015, 2% in 2016, et cetera. And so right now, with the current reimbursement rates already being very painful for most physicians, particularly primary care doctors, a reduction on that order would be really disastrous. It means the difference between staying in business potentially and not staying in business. But I think the more important issue and the bigger risk that they run is that this is really not a federal mandate. I know it feels to physicians as if it's a federal mandate because it is a carrot and stick program. It has an incentive payment and it also has the penalty for noncompliance. However, I firmly believe that by the time we see between 25% and 33%, or somewhere between a fourth and a third of all physicians using EHR technology, that patients, consumers, are going to start voting with their feet. And that means they're going to seek out a physician that does have an EHR-enabled practice because it makes their lives so much easier. They can go online and request refills and go online and request appointments. If they need to be referred for specialty care from their primary care physician, then their entire medical history can be pushed over electronically at the touch of a button. So they no longer have to sit in the waiting room and fill out a lengthy form documenting their family history and their social history and trying to remember, gosh, when was my last tetanus shot? I don't know about you, I don't have any idea when my last tetanus shot was.
Sure.
So the ease of use and I think the confidence that comes from knowing that your critical information about your health can be shared with anyone who needs it, anywhere, at any time, is going to make a real difference. So,
okay. Well, you had mentioned the tipping point in adoption being somewhere between 24 and 33%. Where is the current level of adoption across physician practices today, and what do you think is the biggest hurdle between that number and kind of where we think that tipping point is?
Well, it's extremely low, but it also depends on who you talk to. There have been a number of different studies done. There are evaluations going on in every state that are part of the Medicaid program. Medicaid physicians will be paid through their state division of Medicaid. So they're in the process of evaluating exactly where all the physicians in each state are in terms of their EHR implementation and usage. But in reality, we think the level is somewhere around 9%.
Okay.
Now, when doctors self-report on where they are, they tend to believe that they're farther along than they actually are. But usually what they're doing is using a computer system to track appointments and keep their schedules. They're not actually documenting the clinical information or the actual patient visit and examination in a piece of software that's been developed for that purpose.
Okay. You had also mentioned the comfort that consumers will feel knowing that their information can be shared among medical providers. Is there also changes in consumer perception over privacy and security of their health data?
I think there have always been concerns around privacy and security, but in reality, most of those questions have been resolved through technology. Current technology is extremely secure and extremely private. Now, we hear all the time about events where laptops have been misplaced or PDA phones or smartphones have been stolen and so forth. But in reality, all of the EHR software products, particularly those that receive 2011 certification, which are the ones that are eligible, make the physician eligible for the incentives, they use very sophisticated encryption models. They use various approaches and multiple approaches to patient authentication, and most of us have very little to worry about when it comes to privacy and security of these systems.
Well, it's good to know. As we circle back to the deadlines imported by the federal government, what is the most pressing deadline upcoming for physician practices?
Well, in order to qualify for the full incentive under the Medicare program, which is where probably 78% or thereabouts of all physicians will participate, they need to have their first year demonstrating meaningful use of a certified EHR before 2013.
Okay.
So that means either in 2011 or 2012, they must implement and adopt and then fully become a meaningful user. And that is a process that, when you combine that with the process of selecting and evaluating the right software, we're looking at something that could take from 15 to 27 months. So at this point, you can see we're already a little bit behind the eight ball from the standpoint of getting there by the end of 2012.
For the physician practices that work directly with Hielix, how are you helping them minimize the risk to their practice as they're making these decisions?
Well, we do a number of things. We focus very, very intently on that transition period, the period where the practice is just learning to use the EHR product. And we don't start by using the practice management side, which is the appointment scheduling and billing side. At the same time, we start using the clinical information side, which is where the doctor documents the patient encounter. We usually do those things separately. But we spend a great deal of time in the preparatory phase working with physicians to understand exactly how they currently document their patient examinations, exactly what sort of notes they're taking. There are a variety of different methods that doctors use. There are different charting styles that doctors use. So we work very hard to make sure that we help them select a product that's going to line up and mesh very nicely with how they currently practice. And then we like to put the tools in their hands ahead of time. So if a physician is going from using a paper chart and they're going to be using a notebook that's configured to work like a tablet, which is like a clipboard that the physician can use a stylus and write directly on the screen, we like to put those tablets in their hands well in advance so they learn how to use the hardware before they start learning to use the software. We also work with them to make sure that they are able to take advantage of web-based training and do a little bit of homework so they're more prepared for the live training that usually comes just before the live date of the software. So our most important consideration in any implementation is making sure that we've squeezed down that transition period and that learning period to the smallest possible time frame that it's going to take for the practice to become meaningful users.